Hi, my name is Julie Boyce, United States University, Primary Health of Acute Clients, Families Across the Lifespan, Professor Haley. Today I'm going to be talking about hypertension, complications, treatments, and preventions, and also the goals that we want to set for these patients who's living with this illness. Let's begin by establishing what is hypertension. As we all know and we have learned throughout the courses that of this program, hypertension is having a blood pressure greater than 140/90 or higher. It is a common medical condition in the geriatrics population, but it does not stop there. It does not start there. It also affects young adults, children, teenagers, adolescents. The other day at the office, I had a 17-year-old who plays football, is on the football team in sixth grade. I mean, not sixth grade, I'm sorry, in the 11th grade, who was diagnosed with high blood pressure and started on high blood pressure medicines. It affects different ages, different races. As you can see, I list, it affects blacks, whites, Mexican Americans, Asian Americans. Hypertension among blacks has the highest rate of hypertension related mortality. Um, and I was reading and trying to understand what that come about. And it's simply because the diet, sometimes the diet that African American people take in, excessive salt, you know, they have done studies said that the salt intake and the fat intake increases their chances of having hypertension and highest rate of hypertension related mortalities. Men, women, young and old can be affected by this disease. There are two types of hypertension that I want to mention briefly, and it's essential hypertension, which is known as high blood pressure for unknown cause, and secondary hypertension, which is a result as an identifiable cause. Um, so, in understanding how to treat these patients, we will need to know which one they're in is essential or secondary. This slide breaks down hypertension classification and types. I'm not going to just go over all of them, but I will hit some of the highlights of them because I want to highlight on one in particular. Essential hypertension is mostly what most people have, and that's most of the ones that we're probably going to see primarily in the office. Come in one day and not feeling good. They may be complaining of confusion, blurred vision, just cannot think, uh, and just feeling fatigued. So you check the blood pressure, and the blood pressure is high, and no other cause that you know of. Um, you might have to do a little bit more testing, but they could be into having essential hypertension. And at the top, I got stage 1 or stage 2. And then I want to talk about white coat syndrome. That white coat syndrome is where a person might see a doctor or a nurse or be in the hospital and the blood pressure just stays up. I know my son's grandmother, she was had white coat syndrome, and whenever she had to go to the doctor, her blood pressure would skyrocket, and they I know he would go out the room and come back in and it'd be even higher. And she was like, "My blood pressure keep going up because you keep coming in and rechecking me." Then I also have had other patients since I've been doing my clinicals that would come in the office and they said, "Well, my blood pressure was like 120/60 when I'm at home, but whenever I come to the doctor, it's always up." So you want to get those patients to just do a check of their blood pressure at home and just bring it in, to the office. So we don't want to be treating people unnecessarily. And I found this picture online, just shows you how hypertension can affect the heart. There's nothing really wrong with that rhythm right there, but I just put the heart put that up because hypertension affects the heart if it stays up too high. How are we going to diagnose hypertension? I found an article that states obtain more than one reading, walking, standing, sitting, and lying um, is what we want to do. And you want to do this in both arms. And you want to get a patient a chance to rest. A lot of times when they come into the office, the first thing we do is get them in there and set them down and take their blood pressure, which is, I guess, could be considered a walk-in blood pressure. But if their blood pressure is up when they first come in the office, you definitely do not want to send them out with that high blood pressure. You want to recheck to see what the numbers are. Make sure that the cuff sizes are appropriate. A small adult cuff, a medium, large, and extra large cuff for the ones who need larger cuffs. The office that I'm currently at, they have a thigh cuff. We had a lady that came in very large arms, and we was able to use the thigh cuff on her arm and get a good blood pressure. The reason why you want to make sure the blood pressure cuffs are proper, because if the blood pressure cuff is too big, it will give you an improper reading. If it's too small, it will give you an improper reading. And some of our patients that come in the office, their arms are too small for the medium and the large cuffs. So you want to make sure that the people that you're working with understand to use the right cuff size. Sometimes you can go by signs and symptoms. When I got diagnosed, and I don't mind talking about myself, when I got diagnosed with high blood pressure, I was I thought I was losing my mind. I couldn't sleep, and then when I slept, I felt like I didn't get enough sleep. And when I was reading, I could read something and didn't understand what it was saying. And I just went to the doctor, and he told me I had high blood pressure. Thank goodness that it was caught in time. And sometimes a person with a family history are at risk for having is at risk for having high blood pressure. So we do want to make sure we get a complete history on them. As I mentioned in the last slide, hypertension, obtaining a full history and physical is essential for all patients. But you really want to make sure when they come into the office with high blood pressure that you're really looking at every aspect of this patient. You want to make sure that their eyes are good. You want to make sure that they're not, the kidneys are within normal limits by doing a urine. You want to also get a baseline EKG, draw some blood work. You just want to make sure that you're doing everything for these patients to prevent any further complications. Have a protocol in writing to treat these patients according to their ethnic background per JNCA. I remember listening to one of the programs um, for the review course that we're going to have to take for our certification, and she was saying they're literally in two groups: African Americans in one group and everybody else in the other group. And understanding what you're going to give these patients, each patient that comes into the office with high blood pressure really helps. JNCA have done a really good job. I mean, I have went over it because in clinicals, I'm asked when I have a patient that comes in with high blood pressure, the doctor, he asked me, what color are they? He really do ask me that. And I know he's asked me that to see what I'm going to say according to the treatment plan of JNCA. Um, See if they're smoking. If they're smoking, they're at greater risk of having complications from high blood pressure. Measure their weight and BMI and alcohol consumption. Educate on quantity per sex. Know what the dosage, what the recommended alcoholic beverage is for each patient, according to the male or female. I want to talk about the complications of hypertension because it can cause a lifelong disability. How many times have you seen a patient that says, "Well, I just have a little high blood," or "The doctor gave me this blood pressure pill, but I don't take it every day," or "I never picked it up because I don't believe I really had high blood pressure." It is essential to recognize the symptoms of high blood pressure because high blood pressure can cause cardiovascular events such as strokes, um, heart attacks. It can also cause aneurysm, heart failure, weakened and narrow blood vessels, trouble with memory, understanding. Um, so we just want to make sure that we treat patients and get them on something that's going to work for them and just educate them on the importance of taking their medicines. I have a lot of male clients who are African American and they just feel like I don't have high blood pressure. I literally have to go in and say, look, right now you're just only on one pill. And if you don't take this one pill, you can have a stroke and you can be on a lot of pills. Sometimes I draw diagrams on the board when I'm working at the hospital, and it really gets to them. And they normally take their blood pressure medicine for you and for me, but just making sure they understand and educate really good, and on letting them know this is why you take this medicine. Then you still gonna have some who say I'm just not gonna take it. I had that in the clinic last week. I had a young guy to come in. Blood pressure was really high. He stopped taking his blood pressure medicine, said he wasn't going to start back. He wasn't going to take it anymore. So there's nothing else you can do about that. It's just chart, chart, chart. I decided to add this slide in because we want to make sure. I know that all diabetics do not have hypertension, and all obese people do not have diabetes or hypertension. But I still wanted to add this in so we would know the different comorbidities that increase risk of getting hypertension. And if you notice, I put over there, I got fast foods with a lot of sodas and stuff will cause you to be overweight with the guy in the middle, which leads to obesity. And obesity can sometimes lead to diabetes. And then you can have elevated cholesterol. I also if you see, I put stop childhood obesities. In clinic, I have seen so many children that are way overweight, and one with the elevated blood pressure, the other one had to come back to get his blood pressure rechecked. So we want to educate the parents and the family on childhood obesity. Um, our diabetic patients, if they're not do not have high blood pressure, we want to make sure that they're keeping their numbers down. And then you want to explain to them about elevated cholesterol. I got the HDL. See where they got the little angel, and the LDL where they got the little devil ears and the pitchfork. If you can set up provide a class to educate these patients. Some patients really want to know how they can stay healthy, how they can get back healthy. So if you at any time that you can set up a class at the facility or look for information to give to them to help them would be beneficial for the patient. Okay, remember what works for one might not work for others. And what I'm saying is this is coming down to the patient overall. My mother, she is have had multiple surgeries, so trying to get her out there to start jogging and running and all this is not going to work for her. But you may have somebody who is an athlete come in one day, a couple of days, or 3 days, and their blood pressure is up, or they used to be an athlete and they got off their regimen and the blood pressure is up. So you want to understand what works for one may not work for the others. Non-pharmacologic measures. Weight loss is one. Physical activity is another one. And physical activity is anything that can get your heart rate up. I tell people if you cut your grass, clean your house, you know, anything, just be active, don't just sit around and be a couch potato. Reduce the salt. People who take diuretics should be warned about hyponatremia. I had a patient once when I was in home health. Everything in her house was no salt, no salt. And no matter how much I educated her, you got to have some salt. It's in her head. The doctor said, I can't eat salt. Well, she ended up in the hospital with hyponatremia. I already mentioned about the stop smoking and alcohol intake. Oh yeah, and let elderly patients know about the caffeine intake. It can cause their blood vessels to constrict and cause the blood pressure to go up. So you want to kind of watch that. And then, according to JNCA, you want to do their treatment according to them. And also, I read an article that said if they're on the protocol for JNC7 and it's working for them, don't change it. Let them stay on what they're taking. Some patients may need 1, 2, 3 medications to be and be mindful of male patients with ED. There are medicines out there that can control their that can prevent erectile dysfunction. I do know that the diuretics, just from working in clinic now, the diuretics increases a man's chances of having erectile dysfunction. So if they come into the office and say, I can't take this pill, it's causing this, this, and this, don't overlook that because you want them to be able to take the pills and still enjoy their life. Know the guidelines, prescribe medication with the patient in mind. Remember your teens who are obese. Um, Patient come in, football player, 330 pounds. He's 16 years old. You got to still keep them in mind. They're having high blood pressure. You do not want them to be out there on the field and have a heart attack. I just want to mention the JNCA briefly because we have looked over this throughout the program. But JNCA has provided guidelines to help providers to um, medicate patients according to their blood pressure. Also, they did mention, I remember reading this not too long ago, that JNC7, if the patients who are on JNC7, if that's working for them, do not discontinue that. Let them continue to stay on that. But if you can see, it's broken down into the non-black and black, and then they have an all races category over here too for general population diabetes and chronic kidney disease with or without diabetes. So you kind of want to look over this and learn this. And once you get out and start working, if you know working in the practice, have your own protocol set up to go by and follow if you're able to do that. Here we go down to this wonderful words of exercising, dieting, healthy weight, and I recommend dancing. A lot of times people like to do what they like to do. I'm not a big dancer, but I know some of the aerobic classes like Zumba are very interesting. So I will get in there and do Zumba. Sometimes I'll dance with my daughter if she wants. But any physical activity that I mentioned earlier in the slides presentation, any physical activity that increases the heart, aerobic activity, household chores such as push more mowing the lawn, raking leaves, and scrubbing the floors. And then when I was younger, I would get out there with my kids and my husband. And in the evenings, we would get out there. And while he mowed the lawn, I would rake the leaves. And as we got older and we felt like we was more established in our finances, we bought a riding lawnmower. And I kind of miss those push more days because, as it says, it is exercise. Also, I put down jogging, cycling, and swimming. In conclusion, goals for the patient and providers. I have goals here for the patients. You know, instruct them to keep a record of home blood pressure, especially in the beginning. As they start doing well and they're taking the medicine, they may not have to have one all the time. Develop an exercise plan for each patient according to that patient. Keep a record of meals for 1 week and ask questions. You want the patients to ask questions. Um, physician, I just hit some of it. Set up a dietitian if you have to. Encourage and prescribe. Praise the patient for doing well. And at all, when you don't know, do not hesitate to refer out to a cardiologist if no insurance, no valuable resources that can help you. And these right here. And then also, we have to be an example. We want to try to be as healthy as we can so our patients can see that not only are we concerned about them, but we're concerned about ourselves. And I know sometimes we get caught up in work that a lot of times, especially since we've been in school, you haven't been able to exercise. Sometimes you don't eat right, you stress eating. So as we get out and become providers, we have to take in consideration that we have to be healthy also.